Hi, we're British Care. We're a team of midwives and health professionals. And girls, what do we do? What's different? What other places don't offer?
I think we give continuity of care. So people meet us from the beginning and we look after them until the baby's one if they take the milestones. So when you think that you've gone into labour, you come straight to Gargash, you go straight to the labour ward, you'll be greeted by a midwife.
And the difference is with us, you know your midwife usually. It's someone who you've built up a good relationship with during your pregnancy. So
because we do the private midwife service, so we look after you throughout the whole of your antenatal. We're there at the delivery, we're committed to be there at the delivery, and also we come and see you at home afterwards. So nobody strange is coming into your house, which I think is a good thing.
And this is supported by the latest evidence that if you know your midwife, you're going to be more relaxed when it's your time to have your baby. You're going to produce more oxytocin and you're more likely to have a positive birth experience.
100%. And you're more likely to have the birth that you want because you've really built up this wonderful relationship. We work in twos normally, just in case we don't ever want to let anybody down. So just in case somebody's poorly, you get to know the whole team actually through your journey. We also do events every month so that we're really trying to build up a solid community that really supports each other. It's all about women supporting women. It's all about education, and knowledge is power. Remember that, ladies, knowledge is power.
When they're having a baby, what should they bring to hospital?
Well, a lot of ladies and families like to bring a small bag for baby with all the baby bits separately, and then a small bag for mum. So any personal toiletries that they might want that's very comfortable, postnatal pyjamas and nighties that are good for breastfeeding, they're really good. For baby, a few sets of clothes. We provide nappies and the basic bits for baby, so no need to worry about that.
I've got a hospital checklist which people can get for free. All you've got to do is WhatsApp one of us and we'll send you the British Care hospital bag checklist. I think you need to bring 10 vests for baby, 10 baby grows, 2 light blankets and 10 muslins. I think that's really, really important. Babies spit up a lot when they're first born. And you've got people coming to see you, so you change them a lot, don't you? We do provide all the nappies, we do provide all the disposable knickers, and we do provide all the sanitary products that you will need. You also need practical things like a phone charger. If you've got some really good films on your iPad, it's always good to bring that in. If you like things a certain way, like you said, you like some own personal toiletries, bring that in. We do provide toiletries, but some people have a certain brand, don't they, where they have a specific brand. Hair bobbles, that's the main thing that people forget, is hair bobbles, and sometimes you just want to put your hair up. And for yourself, really, really comfortable clothes and shoes. You're not going to feel like really dressing up for a while. Also for the baby, take an outfit, a going home outfit.
Yeah, I had an outfit for myself and for the baby.
Oh,
so
that's fantastic. Yeah, because when you're leaving a hospital, especially with your first baby, you want a memory. You want a memory. Yeah, by the time I'd had my fourth, I didn't care how we left the hospital.
I went home in my pyjamas with me third and just was like, take me home. First, I walked out in style.
And also, I couldn't go anywhere without a certain hair dryer that I have. And anything else doesn't do my hair the same. So if you've got anything that's like that, that's really personal to you, bring it in, because I think that's really important. You're going to be here for, 3 nights or 4 nights. So you really, really do need to make yourself comfy. Fill the fridge with snacks, everything that you fancy. If I were you, I'd bring a snack bag because you've got a fridge, you've got all that cupboard space up there. We'll provide you with hot water, so if you want to bring your own tea bags, I do like Tetley's or Yorkshire tea. So
In addition to that, for example, you wanted to do the mixed feeding, they are provided also formula ready to feed bottle, so ready to feed milk. So it's really good to know that as well. You have to bring also your personal breast pump so that as early as before discharge, we'll teach you how to use it. So at home, it's more easier for you.
So we do disposable bottles in the hospital. If they bring their own breast pump, we can send it for sterilisation. We have everything here, but I do think it's important for them to know how to use their breast pump, like
Yes.
Mary Grace said, before they leave the hospital. I think that's really, really important.
Even if you use the hospital one, you can still get a little demo
Yes,
from Mary Grace how to
exactly.
use your own personal one.
And I think it's really good, either you book your home where Mary Grace comes and baths your baby, because I know some mums don't like to bath the baby for 10 days, so we can actually come and do that.
Mary Grace really does a fantastic bath demo, and it can be in hospital or she can even come to your home to do it. She'll give baby a lovely massage and she really pampers your baby.
So what are you waiting for? Book British Care.
Some women actually bring everything from home, don't they, and really do the room up and have like a greeting area where guests come and get a gift from baby. And it can be really grand to walk in and it's like, wow.
So when I first came to the UAE, obviously I was used to working NHS in the community, at people's houses, and there was strict rules about 2 visitors, absolutely strict rules. And when I started working here, somebody rang me from the hospital and said, there's 10 people in this lady's room. And I was thinking, oh, infection and all that. So I went there and I said to the lady, you know, I said, you've got a lot of people in here. And she said, yeah, they're not visitors, these are my staff.
All right.
And somebody was doing her hair, somebody was doing her nails, somebody was sorting her feet out. I thought, oh my word, how fantastic.
Yeah. You've got to take care of yourself, haven't you?
Yeah.
And invest in yourself so that you're the best version of you for your baby.
Do any of you remember the biggest baby you've delivered?
I delivered
You've
11
done that
pounds.
big whopper and
Yeah.
with intact perineum.
I know, yeah.
I think they are intact.
I did a really
It was
big
like in the
baby.
pool.
Yeah, it
Yeah,
was, yeah.
yeah.
I did a very big baby in the pool, and the doctor was saying, she'll have a tear, she'll have a tear. I said, no, she won't.
Not in
And
the
she
pool,
didn't.
not in
She
the
didn't have a
pool.
tear, so it was fine. I think it was £11.
And I was saying when you were telling me the estimated weight, and you were like, a mother had one that big, she can do it.
Yeah, yeah.
And she did.
Yeah, she did. She did do it, because a lot of the doctors were saying that she should have a C-section, but she didn't want one, so she didn't have to have one. I think you do have to, when somebody wants to deliver, and you know it's a big baby on board, and you know that most of the doctors have agreed to do a C-section, I would say 9 times out of 10, you probably would agree with the doctors, and you have to be honest with the woman and tell her that. But you've also got to look at the history of deliveries in her family, and then you've got to really plan out the labour. So say we had a blip in the middle of the labour, then obviously we would suggest a C-section. We wouldn't do anything that's dangerous. But actually this labour went really, really well. Everything went well. And we ended up, she had the delivery she wanted. We did have a big baby though, and which was a lovely, gorgeous baby. I do love a big baby.
She said to me, make sure you're around just in case.
Yeah.
But it was all fine and
Yeah.
I couldn't believe it, to be honest.
It was
She was
lovely,
right.
lovely big baby, and a really cute baby as well. We do water births, but we do them a bit different than other hospitals. So a lot of the other hospitals have a bath that's fixed, as we're used to doing pool births in somebody's house. So we have the blow up version, which is a lot softer for the woman.
Yeah.
There's no hard sides.
You can rest on the sides.
Yeah, and you can actually
comfortable.
push the sides down, which women find very comfortable, especially if they want to deliver on all fours. Tell you one thing that you might not know, and I think a lot of midwives obviously know it, is that when a woman's fully dilated, they normally fling a hand back. So they either cling on to the back of the bed. When they're doing a pool birth, they get into their position, and you can just watch them getting themselves comfy. Do not change that position. That is their body saying the most optimal way to have your baby. Same on the bed. If a woman gets on all fours, or she wants to hang over the bed, or she wants to be on her side, again, that position needs to stay. That's that woman's preferred position to give birth. Even though she doesn't know it, that's the way
It's
that
instincts kicking in,
yeah, it is,
so that her
isn't it?
body performs best.
So there's various reasons why you can't have a water birth. It's not advised if your previous delivery was a C-section. It's not advised if you've got any high-risk conditions. So if you've been diagnosed with preeclampsia or anything like that, then a water birth's out of the question. Gestational diabetes, we have to see how big the baby is. That's important. And we really do have to only do a water birth with a low-risk woman.
If there's any risk factor at all, it's not safe to do so. Even, for example, a high BMI at booking, we wouldn't facilitate them, because we need you to be able to be as mobile as possible in case we need you to get out of the pool quickly in an emergency. So it's not that we're being very like, oh, you can't. It's all about safety, and we will only do things that are safe for you and your baby.
The other thing as well, while you're in labour, if you have an examination with consent and the baby's not in a good position, then we would advise you then not to have a water birth. Also, you can be pushing in the water for a certain amount of time. If it looks like it's not happening, you'd be asked to get out of the water as well.
Sometimes people will get in even for a bit of the start of labour or mid-labour, then get out and then get back in. It's really, you go with the flow.
Because it's really good for pain relief as well, isn't it?
The warmth of the water is good for like back pain. Being buoyant in the water takes lots of pressure off your joints. It makes you feel quite weightless, and you can move around, and it's good for some people, not for others. It's very individual.
Yeah, and also if you're in labour and you spike a temperature, it's not good to have a baby in the water then.
First come in, so like a triage assessment to see if you're established in labour. First we'd check mum over, do their observations. Normally we'd do a CTG just to check baby's fine. These are like standard checks when you first come in. And then if it's okay with the woman, she consents, we'd do a vaginal examination, and obviously take a history, how long she's been contracting for, how regular the contractions are, if she's had a show, and then we take everything into consideration and kind of make a plan from there really. It's really individualised, it does depend what the woman wants. Some people don't want an examination and they just want to check baby and check everything's okay.
Also, when you come for admission or assessment, following all of your baseline observations and assessment of maternal and fetal well-being, we'll also do a full history check. We'll check all of your blood results, your serology results. You will have had a swab to check if you're GBS positive, and if you are, we will need to put a cannula into your hand and give you regular antibiotics throughout your labour until the birth of your baby.
In England, they don't actually test everybody for GBS. They have a criteria, and those get tested, and others don't. But here they test absolutely everybody, and it is the safe thing to do, because if you have got GBS and it goes to the baby can be quite ill. So here they're very much preventing a situation because they've got the money to do so. It's private healthcare. In England, they tend to treat the baby if it's showing symptoms of GBS. So that's the group B strep. So it's part of the streptococcal virus.
It's not an STD because
Yeah.
we do
Yeah.
sometimes have women freak
So
out.
everybody's got group B strep on their arms,
Up the nose.
up
Yeah.
the nose. We've got it everywhere. It's if it's in the vagina, and you can have it in the vagina for, say, your first child, but not for your second. So it's just, you know, they test it at that point. They know that you wouldn't have got rid of it by the baby was born.
Yeah.
So that's why they give you the antibiotics as a prevention.
And also they'll do some basic observations for a couple of hours on your baby post-delivery just to ensure the safety and well-being of your baby.
And it hasn't got group B strep. The other thing,
If the baby did have it, how would that affect the baby?
they would give the baby antibiotics then, because if it's left untreated, it affects the baby.
Yeah.
If it isn't left untreated, then it's fine. The other thing as well, if your baby does have antibiotics or you have antibiotics in labour, just to say your baby's cord will stay on longer.
I didn't know that.
Yeah.
So you told me that.
Yeah. So if normally the cord falls out off between 5 and 10 days,
Yeah.
if you've had antibiotics or the baby's had antibiotics, it's 10 to 15 days.
And I've seen it lately now when
yeah.
I've cord's still on quite a little bit later. I say, have you had antibiotics? And they say, yeah.
So ladies, at British Care, we
We really do care.